Well, good afternoon, everyone, and thank you so much for joining. My name is Angela Lindstrom. I'm the Director of Communications here at the Health Center Association of Nebraska. I appreciate your time today, and I thank you for joining. Today's webinar is the advocacy training. We are hosting this along with two special guests. Sarah Franţois is the Deputy Director for the Grassroots Advocacy and National Association of Community Health Centers, and Kaitlin Reece is with Catalyst Public Affairs of Nebraska. After the presentations today, we will send out the recording along with the slides in case you want to share with any of your staff. We will be having a questions and answers period after the presentations. Otherwise, you can feel free to use the chat box to type in any questions that you might have. Today's webinar is being recorded, and we will send out that recording as soon as we are done with the presentation. Again, thank you so much for joining. Let's go ahead and jump in. Sarah, the floor is yours.
Perfect. Thank you so much, Angela. I really appreciate the opportunity to be with you all this afternoon. I hear you're in the middle of a snowstorm, and so I am extra grateful that you're joining us. Prior to my time, it's a great segue because prior to my time at NACHC, I've been with NACHC for about a year and a half, and prior to that, I actually was at a community health center for about 15 years in Milwaukee, Wisconsin. So I am very used to snowstorms. I grew up with them. That is where I was born and raised. So I can definitely appreciate that. I have not actually seen any snow since I moved out to DC. So I was a little sad when I went home this weekend and there was no, or for Christmas, and there was no snow in Milwaukee. But thank you all for joining. As was stated, I'm the Deputy Director of Grassroots Advocacy here at the National Association of Community Health Centers. So my role today is really focused on mobilizing, right? Mobilizing advocates, education, so doing a lot of training, what I'm doing now. I also manage some of our advocacy programs. I work as part of the Grassroots Advocacy team, so you might be used to seeing and hearing Susan Burton. She's our director. So that name might be familiar to you. And we are part of the larger public policy and advocacy functional area at NACHC. So Joe Dunn is our senior vice president. He's one that people know a lot. I also work closely with Visharia Keys and team on regulatory and policy issues. So very happy to be with you and kind of give you a high level overview of what advocacy means to us. But I do just want to reiterate that I come from the health center world. So I have sat where all of you have sat. I started my career in health centers kind of backwards. I went to journalism school and thought I was going to be a sports writer. And then I did not end up doing that. And I started working at a local community health center in Milwaukee instead. And it ended up being the best thing of my life. I didn't know anything about medicine. I didn't know anything about health centers, but I grew in my role there, started out doing a lot of marketing and outreach activities, then started doing a lot of grant writing. I have submitted countless UDS reports. I've participated in OSVs. I've worked on capital campaigns. We tripled our patient population during the time I was there and added a lot of services. And I even delivered the mail when I first started at our health center. So I've done a variety of different things, as I know all of you do in all of your work as well. But I appreciate you taking a few minutes to come and learn about advocacy today. So as part of the national strategy that we have here at NACHC, it's really about bringing together all of us in an advocacy network. So it's about mobilizing, equipping, inspiring, inviting, and building this advocacy network that we have. So hopefully you see yourself in one of those categories that's listed on the right-hand side of the screen. Obviously, NACHC is here, but we can't do it without the state associations and our health center networks. Certainly you, the health centers themselves, board members, patients, I really hope that you see yourself in this list. You really should. But I think it's important to recognize that we are in this together. None of us can do this on our own. And so that's really what we're about here on the national level. If you've sat in on any of our presentations within the last year, some of these graphics might seem a little bit familiar to you. But the one on the left, we always refer to as our snowflake, right? So we like, and it's very apropos today since it's snowing there. You can see the snowflakes in your window, right? And you can see them all building on top of each other. And they're creating snow outside your windows that you can go sledding in and do whatever. But one snowflake's not going to do a whole lot, right? They build on each other. And so in our case here at NACHC, we look at ourselves as the middle yellow dot, kind of that center. Or you might be that center dot for your health center. And as a group, we need to build that network. We need to build that center out into the green dots and the blue dots to continue to grow that snowflake so that we can advocate effectively for healthcare for more than 31 million people across the United States. You're all individual health centers, you're all serving in your individual communities, but together we are much stronger as a health center movement, which allows us to build power, which is that second graphic, right? The more people we have, the more power we are able to generate, especially when it comes time to things that we're advocating for. Like right now, we're advocating for health center funding. That's just one example. But we're really all about building this power in our network so that we can shift things. I always like to start these presentations by taking us back to the very beginning. And some of you may have been around since the very beginning of the health center movement. I was not. But I like to remind us that the health center movement didn't start out with a pile of money from the government, right? We all rely in some ways on government funding and public support and those kinds of things, but that was not around when health centers started. Back in the 1960s during the migrant farm worker movement and the civil rights movement, health centers started because community members saw a need that they needed to address. They saw inequities, and they decided that they needed to rally together to make things right. And then as they kind of proved themselves and proved like, hey, we're really good stewards, we provide really good care, we're really good at what I do, that's when investments started to be made, right? So I think if we go all the way back to the beginning and say, this is really how this started, we need to continue to evolve. But let's go back a little bit to our roots and talk about how we all did this together as a movement, right, to get to where we are today, serving now more than 31 million patients across the country. So what is advocacy? Certainly advocacy can be going to Capitol Hill. It can be showing up at your legislator's office, knocking on the door, putting in a phone call, writing emails. Those are all very important things. But I would actually argue that we're doing advocacy every day in our lives without even really thinking about it as advocacy, right? Maybe you are a parent and you're part of the PTA at your child's school. And, I don't know, maybe they're advocating to take away chocolate milk, right? And only have whole milk. You want your kids to be able to have chocolate milk. So you might be writing into the school or whoever to say, no, we want to keep chocolate milk around, right? That's a very basic level example, but I think we all advocate for things that are important to us in a lot of ways without even realizing that it's advocacy, right? Maybe there's an animal welfare association or something that's really important to you in your community. Maybe you're trying to get a stop sign put in down the corner because people keep blowing through an intersection. And so that's important to you. That's also advocacy. And so I think it comes in a lot of different forms. It doesn't have to be just the traditional stuff where people are going to the Capitol. That can be intimidating to a lot of people. That can be uninteresting to some folks as well. So I challenge you as part of today and moving forward, thinking about advocacy from a little bit of a different lens, how you're doing it in your everyday life. That might be outside of the norm of what you think advocacy is. That said, advocacy really can be broken down, I think, into two distinct areas, right? There's the legislative advocacy, which is lobbying, and then there's the grassroots advocacy, which is what I'm really focusing on. But NACHC, at the National Association, your state associations, they are really doing that legislative arm for you. They have registered lobbyists. We have registered lobbyists on the national level. We're putting together policy that we think is going to be beneficial to health centers and your patients. We're spending a majority of our time on Capitol Hill or working with consultants and figuring out what is the best vehicle to get that funding or that legislation passed, right? We're getting paid to do that work. And elected officials know that, right? That differs from what you're probably doing on a grassroots level or what we really want you to be involved with on a grassroots level at the health center. That's really more about the education piece, right? Education really helps support the lobbying efforts that we are doing on a larger scale. So if you're inviting somebody to come to your health center and learn about your behavioral health program, that's fantastic. You're providing education. That's advocacy, but it's not the same thing as lobbying. It's not the same thing as legislative advocacy. And, we have worked pretty closely with our legal team at Feldman Tucker to really define more about what is the difference between the two types. And I think by and large, what we have discovered and what can be broken down to is most health centers, most of the work that you're doing on your local level is never going to be something that's considered to be lobbying. You're not doing it to the degree that it would end up being lobbying. And we'll talk about this a little bit more when we get to the next slide here. So these are some of just a snapshots of legal implications for advocacy. I think the number one thing, making sure that we're remaining nonpartisan. You all can read these But I think those are the things to call out, right? We never want to make it seem like we are supporting one political party or candidate over another. If you're having events, you want to invite everybody, right? You want to invite all your legislators. Not all of them are going to show up, and that's okay. But if you have proof that you sent the invitation, then you're good. That is very nonpartisan. We want you to bring people into your health center. We want you to invite elected officials, host candidate forums and discussions and other things. We even want you to get involved on social media to the degree that you feel comfortable, but just always doing it in that nonpartisan way. That last bullet point under do, I think as a former grant writer, I can say this is one thing that I would recommend all health centers do, is book a small percentage of your salaries, all of your staff salaries, with non-grant funds. Because this is where people might feel like they could be crossing a line, right? If you have a person who's covered 100% under your Section 330 grant, that is where the lines might start to get a little blurry if they begin to do advocacy activities. Because technically, if they're showing up to work, 100% of their time is being covered by federal funds, by public funds. That could throw up a little bit of a red flag if somebody came in to do an audit. However, if you suddenly have that person covered only 95% by your 330 grant funds, now that's leaving 5% of their time that can be dedicated towards other things, right? There's a few limitations to this. For example, if you have like an AmeriCorps worker at your health center, their salary is being entirely funded by federal funds. That's how that program works. And so you don't want them to be doing any type of advocacy work. But by and large, for just about anybody else at your health center, as long as they are not being 100% paid for via public grant funds, it's a lot easier to justify any time they might be spending doing that educational or that grassroots advocacy. On the don't side, I think it's pretty self-explanatory. The one thing, especially as we're going into a campaign year, when obviously a lot of elected officials are going to be up for re-election, is we want to be sure that we're not engaging in any campaign activities. So you want to invite an elected official, sitting elected official, to come and visit your health center, but you want to be very careful that they understand that that's not a campaign stop for them, right? They're coming to learn about the activities that you're doing at your health center, but they might say, hey, we'd love to take a picture of you and your staff and put this on our campaign social media page. And the answer to that would be no. We really appreciate you coming here, but we want to make sure that we remain nonpartisan. And so we would not advocate that you do that, right? There's a ton of videos on our website now that we've actually recorded, and I'll be sure to include that in the information that you all get sent so that you can break this down into little snippets. You can share with your board, you can share with your leadership teams to really learn what you can do and what you can't do. But by and large, again, you guys are providing education for the most part. And so that's not something that blurs a lot of lines. Also, it's okay to do voter registration activities at your health center. We definitely recommend it. Partnering with organizations like Vote ER, of course, being nonpartisan, and of course, reiterating that you're not telling anybody who to vote for. You can actually even serve as a polling location, believe it or not. That is something that is legal for health centers to do. So we hope you all get engaged with voter registration activities to the point that you feel comfortable. But obviously, biggest thing is you can't tell people who to vote for. So storytelling is absolutely the most important part of advocacy, in my opinion. Again, I get paid to do this work. Your PCA staff gets paid to do this work. You're even getting paid to do this work in a certain perspective, right? Although you have a lot more personal stories probably to share. We're not necessarily always the people that legislators want to hear from, right? They want to hear from the people who are receiving services, or the people who are literally seeing the patients on a daily basis and understanding this work a little bit better. It helps them paint a picture. So again, community health centers are very unique in that we have consumer majority board, right? So at least 51% of your board members are also patients receiving your services. So they are a great place to start when it comes to these types of storytelling initiatives. The key here is we're trying to move from a very transactional relationship to more of that relationship building concept. So I liken it to, it's Girl Scout cookie season, right? You're probably going out and selling Girl Scouts, or somebody's trying to come to you and buy Girl Scouts or Girl Scout cookies. I don't have any Girl Scouts in my life. I probably don't need the cookies. But if one of my best friends or one of my colleagues that I know well and I trust comes to me and says, hey, you know, it's Girl Scout cookie season, would you mind buying a couple of boxes? I am probably much more likely to say, yes, I don't need them, but yes, I enjoy them, because I know that person, right? We have a shared value, a shared interest in helping support the community, helping support the initiatives that the Girl Scouts are doing, right? So it creates that shared opportunity. Again, that's a very rudimentary example, but it's something that we all are probably familiar with in our own daily lives. So lots of pictures here. I borrowed all of these from my health center days, and I just like to point out this is what advocacy can look like, right? In a lot of different ways. It's giving legislators awards. It's doing ribbon cuttings, and when you're opening up a new facility. Maybe you're hosting a press conference at your site. Maybe you're doing things online when you're meeting with legislators. That's all great. I would like to draw your attention to the middle picture, though, because that is my favorite, and that is the best example of advocacy in action. This is one of the state legislators in Milwaukee, Wisconsin, Robin Vining. And that is our dental director that was at my health center, Progressive Community Health Centers. Her name is Dr. Amy Shea. Rep Vining came into the clinic. She was actually very interested in maternal health issues, but we gave her a tour of the clinic. We went down to the dental department, and it was so interesting because both of these two recognized each other. It turns out that Rep Vining had actually just recently had a baby, as did Dr. Shea, and their older children actually went to the same school. They saw each other in pickup lines when they were driving and dropping kids off and doing all that good stuff. They had no idea who the other person was, right? But they immediately developed this shared connection and this relationship, number one, because they were new moms, right? They had that in common. Number two, because their kids went to the same school. And number three, because they both cared about healthcare for underserved populations. I stepped aside in this picture. I said nothing. I let these two talk to each other. We were actually looking in Wisconsin at passing a dental therapy bill. I believe it still hasn't gotten there quite yet, but as a result of this conversation, Rep Vining said that she would support that dental therapy bill, or she would support looking into it further. Dr. Shea was not an expert in policy or politics. That was not her primary area of expertise. Her expertise is teeth and being a mom, right? Two things I don't have any expertise in. So it was very easy for me to step away and let them do the talking and really see how that played out in action. So I encourage you to think of these types of interactions as people are coming to visit your health center, and as legislators might be coming through the door. Who might be an advocate for you, or who might be a great person to talk about these issues that might not be the first person that you think of, right? So how are there ways to get involved? And we know we don't have enough time today to get into all the policy issues that NACHC is working on here at a national level. I would say a few things. First of all, the thing in the middle. If you do not already receive our weekly Washington Update newsletter, which goes out on Tuesdays, every Tuesday, health center news you can use, please sign up for it, because that is the best way to continue to get updated information from our team about what's happening on a national level. I would also encourage you to have your staff sign up for it, or at least your board of directors and your leadership team at a bare minimum, just so that they can be getting this information. We also do things on social media like Retweet of the Week. We have social media graphics and ready-made resources for you. There's lots of stuff. We're revamping our own website. We just hired a new communications manager, so you can find stuff on our website at hcadvocacy.org. It's kind of under construction right now, but again, places that you can go for things like video snippets and other things, resources that you can use where you don't have to recreate the wheel, because I know you are all very, very busy people. Also just wanted to highlight things like our Advocacy Center of Excellence program. So this is one program that I oversee. We look at health centers that are kind of going above and beyond in the advocacy space, and you can earn a designation, an ACE designation in the bronze, silver, or gold category. This designation is good for 2 years, and you can always reapply or increase your designation at any time. You can find out more information to apply there, but I just want to take you to this slide so you can see what these designations kind of mean. My guess is a lot of you, if you look on that bronze status designation, a lot of you are probably already doing much of this work in some capacity, and you're just not getting recognized for it. And so we want to be able to work with you. I'm very proud to announce that your state association became our first PCA level ACE of 2024. And so they have committed to working on a lot of these advocacy things over the next 2 years. And one of their goals, I hope I'm not giving it away, is that they hope to recruit at least one ACE health center from your states to join the ACE program. So happy to talk more with you about this if this is something that interests you, or if you think you might already qualify. I'm always happy to do kind of a little ACE tutorial, but I just want to show you that it's probably a little bit easier than you think it is, and the application is not long. I'm not looking at SAC grant applications here. It's 3 pages, and 2 of those pages are demographic info. So definitely not trying to take up a lot of your time and resources in terms of completing an application. We also have our advocacy leadership program. This is more for individuals. So ACE status is designated to the health center. Advocacy leadership program is a 4-month kind of cohort that's dedicated to building individual advocates and helping you create a culture of advocacy at your health center. Our next cohort is scheduled to start in March, and we will be opening registration for that soon. So definitely look for more information related to that. You can always join our monthly combined policy call. This is open to anybody. So health center leaders, staff members, board members, it always happens on the 2nd Thursday of the month. So we have one coming up, I believe this week. Yes, it's already this week. So this is the best way to understand what's happening on Capitol Hill and what we're doing to help support health centers. And finally, I would just invite you personally to our 2024 Policy and Issues Forum, which is coming up in February. We're going to have a lot of different advocacy highlights there. And then, of course, an opportunity to go to Capitol Hill here in DC and meet with your legislators on a federal level, face to face. So again, you'll get a copy of these slides. I think we're waiting on questions until the very end. Is that correct, Angela? But appreciate the opportunity to spend some time with you today and look forward to working with you all very in the future.
Great. Thank you so much, Sarah. I really appreciate that presentation. That was great to hear from you from a national level. I'm really excited to be your first PCA ACE program. So we're really excited here at HCAN for all the things that are to come in 2024. So thank you for that presentation. Okay, up next on a Nebraska level, we're going to introduce Kaitlin Reece. She is with Catalyst, and she's going to talk about advocacy at the state level and what we can do here at the state. Kaitlin, you can go ahead and share your screen.
All right, it's loading. I have a slow old computer here. Can you?
I don't see anything yet, but
Sorry, I think my computer is having some issues. Can you hear me?
yes.
Okay. My computer just froze, so I can't really do anything. Sorry. I've been on Zoom calls all morning and this has not been a problem. I will try and maybe log out and log back in. My apologies.
No problem at all. And while she is logging in and logging out, is there any specific questions for Sarah at the national level? You can feel free to chat in the box too if you're unable to go unmute.
And while we're waiting, I'll go ahead and throw some links in the chat as well. Like if, for example, if you're not signed up for our Washington update, I'll throw that link in the chat so you can easily sign up and make sure that you're registered.
I guess I have a question. So oftentimes, there's a NAC or a PCA call to action that involves, following a link, put in your email address and phone number. And I just always have this thing in my head, which is I have a computer that belongs to my health center. I have a phone that belongs to my health center and an email address that belongs to my health center. What are the do's and don'ts about how to participate in something like that with those variables?
Great question. And so I think there's a couple different ways to look at this. Again, I would go back to, how you're being paid for, which at an executive level, you guys might know that. Of course, if, I'm a front desk staffer, I probably don't know how I'm getting paid, right? And I think that's one of those reasons why we always recommend booking that small portion of salary on non-grant funding so that you kind of eliminate that, because then you can say, hey, this person was not doing it on that time. The other thing we also recommend is doing it on your lunch break, right? Everybody gets to take a lunch break. That's mandatory. And, in all states, you have to be able to get a break if you're working a certain amount of time. So we certainly recommend that. You're also able to, when you click on an action alert, even though you might have received it, let's say via your health center email address, you are able to respond to it via your personal email address. So when you click on that link, it will oftentimes ask you for your information once again, so that you can then get connected to your local legislator. And so that is another recommendation if people are worried about that they can certainly respond to it from their personal email address and of course their home address as well. So those are some kind of high level things. Again, by just completing the action via, an email from, I get stuff in my email all the time, right? It's likely not going to get tracked back to that level and that degree. But we always like to say, hey, do it on your lunch break or do it right before you're closing up for the end of the day. Or again, respond from a personal email address if that's something that you're really concerned about. Does that help?
Yeah, that's great. Thank you, Sarah.
Mm-hmm.
Okay, Tim, I did get the slides, but now I don't see Kaitlin. Is she coming back in?
I'll text her and have her pop back on, but if you want to bring it up, that would help.
All right, I'm gonna go ahead and share my screen. Daphne, are you able to, from your perspective?
Yeah, would you like me to share my screen?
Yeah, would you be able to?
Yeah, no problem. 1 moment. How's that look?
Yeah, that's perfect. Thank you.
Great.
Tim, should we wait for Kaitlin to join back in?
I was texting her now, but I can get started with the basics if you'd like.
Okay, if you
Yes,
don't mind.
ma'am.
Sorry to put you on the spot.
No, it's no problem. If you can handle my cold, I'm battling a little cold right now, but no problem. So, yeah, we just wanted to talk to you about the differences of the unicameral, which I think most of you probably would know. If you want to go to the next slide, I don't think I can control the slides, or if I can, I can't figure it out. But the uniqueness of this is what we've found is being in this unicameral. It's you never know who your advocate is going to be. I mean, because even though it's supposedly nonpartisan, we know it's more of a partisan. Democrats will fall in line on one thing and Republicans will fall in line on some things. But once we do go advocate, and if you can advocate, you will find things just like was just mentioned, that Sarah mentioned, where the state rep knew, the doctor there. So it's a small world, a small state, of course. So we love any way you can advocate is good. Like I say, the key leaders just pop out of nowhere. And the more we work on one person going, it's best, because that person then kind of gets to know, oh yeah, I know kind of what they're talking about. People will not talk unless well, I should say that most people don't want to talk on the legislative floor for an issue unless they know what they're talking about. So your advocacy really helps get them maybe to step up and say, wait, that's not right, or here's how it works. So we're in a short session this year, which means everything's going to be very compacted, 60-day session, and the budget can be tweaked, but not completely rewritten. So even now in 2024, we're working on 2025 issues. Although we'd like to get things done in 2024, it's always good because many of these senators will be returning, many won't because of term limits. So you can go to that next slide. Just really quick, the staff, I'll just mention the staff. Because we're at a term limits, the staff is super important, that we also kind of include them on advocacy. A lot of times they will have time in the summer. This year we focused mostly on some of the key senators on the appropriations committee to come on board. and we visited with them and did some great tours, Kaitlin and Liz and all of your help. Really appreciate that. I thought some of those tours were really good. But don't ever underestimate the staff, if we can get them to come as well, because they're key when we come to writing the bills, and senators will say, oh, well, what was that one again? Oh yeah, thank you. And they will use that staff as a resource because they have so many different bills to follow. So anyway, you can go to the next slide.
And I think Kaitlin is back,
Yeah,
Tim.
Kaitlin, if you want to jump in, I'm just at the point now where we're finishing up the legislature.
Okay. My apologies, because of the snowstorm, I'm working at home. So I'm working with an older computer than what I typically work with. And of course, it decided that it couldn't run multiple things at the same time. So I am hoping that we have no more technical difficulties. And of course, then logging out and logging back in takes longer because it's an old computer. So my apologies. All right, so I just wanted to give kind of people a snapshot, realizing some folks may be very familiar with where we are in terms of the session and kind of how the legislature works, and some may be less so. So this is kind of an opportunity to level set and let you know where we are in the process. So the legislative session began on January 3rd. And hearings will begin in a few weeks. Right now, we're doing bill introduction and rules debate and rules hearings. So hearings on substantive bills will begin on Monday, January 22nd. In Nebraska, every bill that's introduced has a public hearing, which is very different than at the federal level or even in other states. Typically, in a short session, which is what we're in right now, bills that were introduced last year carry over. And that typically means that morning floor debate on those carryover bills can start right away. This year's a little bit different because we have 34 proposed rule changes that the legislature is considering. So we may spend as much as 3 weeks debating rule changes before floor debate begins on carryover bills. We also have at least 4 bills. As of this morning, I haven't checked if there's been more that have been designated as priorities today. In Nebraska, every senator gets a priority bill, and committees can designate up to 2 priority bills. And so those bills get priority over others in terms of debate on the floor and scheduling. It's unusual that we already have 4 designated. So those 4 bills will skip over any other carryover bills that were just waiting in line and kind of queued up from last session. Next slide, please. So I want to talk a little bit about last year, because my guess is even if you weren't following the legislature really closely, it was kind of hard not to hear about what was happening last year. And it was a really unprecedented, after COVID, I got really tired of using that word, but here I am using it again, unprecedented year in the legislature. So we had over 800 bills, which was a very high watermark. The last time that many bills were introduced was in 1980 when we had 850 bills. And you might have heard that we didn't get a lot done last year. And if you looked at the number of bills that actually passed, that you know, that might look to be the case. There were 31 bills that were passed into law. But within those 31 bills, there were actually 291 bills that were packaged together in Christmas tree or omnibus bills. And I just have the last couple years of data so you can see how, you know, the number of bills was about what we have seen in other legislative sessions, but the number of vehicles that were used to pass those bills, obviously much smaller than other years. And so I call them Clark Griswold Christmas trees because there's lots of bills wrapped in these packages. So we were seeing 10 to 20 bills getting packaged together, and then additional bills being added during multiple rounds of debate. And the reason for all of this is because we had extended floor debate. We had nearly every bill was filibuster, taking the full amount of time, which is 8 hours on the first round, 4 hours on the second round, and 2 hours on the final round of debate. So given that, there was a lot of packaging. Now, I don't think, next slide, please, that we're going to see the same type of behavior next year, or this upcoming year that we've started, because we've got, and that also explains why we've got so many rule changes. Typically, we don't see as many rule changes the middle of a session. between the long and the short session, but because of some of the challenges last year, there is this renewed interest in changing the rules. So whether the changes will be adopted or will change some of the patterns that we saw emerge last year, still unknown. We should know in the next couple of weeks what that looks like. But that's some of the background and kind of why the legislature isn't necessarily getting to work in the way that they usually do at the beginning of the session. Next slide, please. I want to talk a little bit about committees because this is a primary area when you're doing advocacy that we would be engaging with folks, and knowing committee membership and how the committees work is really important to kind of identifying key people to contact. So in Nebraska, there are 14 standing committees and then several special committees, and they organize around specific issue areas. Committee chairs have 2 additional staff in addition to the legislative aid and administrative aid that we talked about earlier. So they'll have a legal counsel and a committee clerk. And if it's a large enough committee, like the Health and Human Services Committee, which sees a lot of bills related to health policy, they'll actually have 2 legal counsels because of the volume of issues. And if there are 2, they tend to each focus on specific areas. And senators have to serve on at least 2 standing committees unless they're speaker, then you have other duties, so you don't have to serve on any committees. Or if you're on the Appropriations Committee, which is another major committee that we are often in front of regarding health policy, particularly funding, you only serve on the Appropriations Committee because they meet 5 days a week. Next slide, please. Okay, so we are at day 4 of day 10 of bill introduction, so we still have 6 days to go. That being said, we did want to talk a little bit about some bills that we've already identified as that we're watching for health centers, and just so that you have these kind of topics in mind as we talk about some of the statewide advocacy, the state-based advocacy that you can be doing, that we're inviting you to do this session. So know that we have been working with Amy, and part of our meetings this summer with health center directors was aimed at getting some additional funds for behavioral health care and then innovation grants for whether it's workforce, infrastructure, or other crucial needs of health centers. There was a bill that was introduced by Senator McDonald last year. It was not ultimately included in the budget package. We are again working with Senator McDonald and have made some tweaks to the bill that we think will put us in a really great position moving into the session. So that bill hasn't been introduced yet, so I don't have a bill number for you, but it will be coming soon. And that's really going to be our highest priority in terms of the health centers at the state level this session. Another couple bills that we're keeping a close eye on, LB 913 would expand postpartum coverage for moms who are undocumented. Last year, we passed legislation for other moms that qualify in other categories for 6 months. The department ultimately extended that to a year of eligibility after the birth of a child. So this is trying to catch up some of that coverage for our LB 599 moms that are undocumented and eligible under that provision, that category of Medicaid. LB 944 makes some changes to the Medicaid Managed Care Excess Profit Fund. So this fund is, if there are certain profits that managed care organizations exceed, there are some guidelines on how that money can be spent. Right now, and the account fluctuates. Sometimes there are funds, sometimes there aren't. This last year, there were some excess funds, and that's being put towards the Medicaid unwind. But in the past, it can be used from anything related to filling service gaps, system improvements, sustaining access to care. The bill, LB 944, would be to redirect any future funds from this excess profit fund to provider rates for behavioral health service providers. And then LB 935 appropriates $6 million in general funds to the Department of Health and Human Services to increase provider rates for dental services for Medicaid patients. A behavioral health specific bill, Senator Dorn has another bill that appropriates $8 million, and I've got the percentages there, to our behavioral health regions to help move mental health crises out of our emergency rooms, fund crisis stabilization, and fund youth and adult crisis services. So it's a pass through the regions to address some of those issues. Next slide. And then the final area that we wanted to highlight, just a few bills, is on supplemental nutrition assistance program. We know that social determinants of health are a big part of the overall picture of what helps support someone's health and either that keeps them healthy. And so traditionally, HCAN and health centers have really looked at many areas related to social determinants, but particularly nutrition. And SNAP, the Supplemental Nutrition Assistance Program, or you might know it as food stamps, is a big piece in that and making sure people have access to nutritious food. So here are two bills already related to SNAP that have been introduced. LB 882 would make it easier for SNAP recipients to utilize online ordering. A lot of people use Hy-Vee online, Hy-Vee aisles or other online food delivery services for their groceries. This would require the state to pick up any delivery fees for SNAP recipients who want to take advantage of those programs, unless federal funds become available to cover that reimbursement. And then the other bill is LB 952 by Senator Day, and it would require DHHS to opt into the summer EBT program to ensure children have access to food during summer months. Nebraska is one of very few states that hasn't opted into this program that started during COVID, and states have an option to opt in. And so far, Governor Pillen has not been willing to opt into the program. And so this would require that the state opt into the program. So we've got a lot more days of bill introduction to go, and likely many more bills of interest for health centers, but we wanted to give you kind of a snapshot of some of the issues that we're likely going to be dealing with and asking you to contact your senator about this session. Next slide, please. All right, and I think for some reason you're just gonna have to click. I don't know why this one was set up that way. Okay, perfect. All right, so we know you're very busy. And so first want to say thank you for spending some of your time engaging in state-based advocacy. And I echo, there's, I loved the presentation earlier, and I think there's a lot of complementary work that can be done both at the federal and state level. And we know because your time is precious and there are many other things that you're doing, that thinking about timing is important, both so that you are getting the most bang for your buck, so to speak, out of your advocacy, and making sure that the time that you are spending is well spent with senators so that that message has relevancy and stickiness, and they're more likely to remember your message when they go to cast a crucial vote. So again, any advocacy is better than none, but there are better times to contact senators to really maximize your impact and really stretch the hours and the time that you are spending contacting them to be most effective. And I want us to think about who your messenger will be. I think we talked a little bit about this earlier, but think about your staff, your board members. Many of your board members have lived experience or community connections that are extremely valuable to senators. That oftentimes, if it's a community facing individual, they've got connections with senators that you can really draw on. They have a reputation that can really help raise the level of, it can just raise the profile of the message that's being delivered. So really think about that. And also maximize your testimony. If you plan on testifying at a hearing and you can spare a few more hours, we have found it's really effective if you're able to spend time visiting with senators on the committee ahead of time. Tell them what you're going to say at the hearing, so that way they're hearing it multiple times and the message really sticks with senators. If you haven't testified before, I think this also helps with some nerves, because you're able to meet with senators one-on-one and the faces look a little more friendly after you've had a chance to visit with them in the rotunda before you have to go and sit in front of them at a hearing. And of course, if that was something that you were interested in, we'd be happy to support you and be alongside you every step of that way. I would also say, really get to know your senator. Do you know what committees they serve on? Because when you're advocating on a bill and it's still in committee and we're at the hearing stage, really focusing on committee members is key. With so many bills introduced, senators kind of clue into their committee bills and their individual bills first. And then once bills advance to the floor, that's when they're really ready to focus and hear messaging about bills that are on general file, that are ready, coming up for their vote on the floor. So again, early on, focus on the committee members, and we can definitely help with that if you've got questions. And then in general file or other rounds of debate, that's when you should really be focusing on other senators, your senator, or senators that have clients or that will have constituents that are clients of yours in their district if they're not on the committee. Next slide, please. Okay, so that's kind of it in a nutshell. I'm happy to take any questions. And apologize again for some of the technical difficulties.
Thank you so much, Kaitlin. Any questions for Kaitlin? And at this time, we'll open up the floor for any questions, really. So if you have any for Sarah or for Kaitlin, please feel free to either chat them in the chat box or come off mute.
While people are kind of percolating on what's been shared, I also just want to say I hope this is the first of many conversations and information that's shared so that we can be communicating with each other. You know, when there is a hearing coming up, okay, this is the time to rally. I mean, I think this is really an invitation to think about as a health center, who can I engage within my sphere, whether it's staff or board members or both. And then that way, when we've got kind of the call to action of, okay, we've got our hearing on funding, it's going to be a week from Wednesday, we're already kind of, you know, prepared to activate some of those folks to then be making calls into or emails or both into senators' offices. I share this a lot with groups that are thinking about advocacy at the state level. I think when we think about advocacy, sometimes we think about the volume of calls that our federal delegation receives, and that advocacy is really important. And a couple of years ago, this is a friend of mine's story, but she gave me permission to share it. She was working with a senator, and a senator came up to her and said, I need you to call off your dogs. I am getting way too many phone calls on this issue. The message has been received. I tell them to stop calling. And my friend, the advocate, said, oh, okay. Can I ask you how many calls you're getting on this issue? The answer was 15. So the number of calls and emails maybe doesn't have to be this huge thousands. If we get that many people to call in about a healthcare issue, wonderful, but it doesn't have to be that high of a volume for senators to really pay attention and for your advocacy to have an impact.
So Kaitlin, that kind of leads perfectly into my question. At the state level now, we have this online comment portal that's been around for a couple of years. Is that an impactful way to get comments in for the hearing? Is it better to email the senators directly who are on the committee that are hearing the bill?
So I think it's better to email the senators that are on the committee, because not all, I would love to say all senators check the portal all the time, but I don't think that that's probably true. If you have the bandwidth and the time, the comments can be the same. But if you have the time to submit them on the portal, so that maybe when we're in floor debate, a lot of senators use that portal when they're trying to think of what to say during floor debate. They may read comments. These were comments submitted by someone who was in your district, you know, Senator Bosin, and then they'll read the comments. So there is a there is value and there's a time and place for the portal. And I think for committees making decisions, I think sending an email to the committee, again, content can be the same across both of those platforms. But that way you're really maximizing, you've already done the work to come up with what you want to say. So why not maximize kind of the availability? That way the portal will eventually, it's available to any senator, even if they're not on the committee. So that would be my suggestion.
Great, thanks.
Yeah.
And then Sarah, question for you at the federal level. I know that often in the advocacy alerts that NACHC puts out, you talk about tagging our members of Congress. Can you talk a little bit more about the value of that and the impact that that has on them?
Yeah, it's a great question. And I would say, you know, social media is something that if you're not involved with it on a daily basis, you don't use it regularly. I know it can be kind of intimidating, but I will say, you know, no matter how you feel about Twitter or X, it is still the #1 platform in terms of getting in touch with your elected officials at this point. You can, I mean, and we still definitely advocate for, you know, sending emails. I echo what Kaitlin says in terms of phone calls. You know, I mentioned Joe Dunn is our senior VP here of public policy, and he actually has worked on the Hill. And he just made a comment the other day that if a congressman or a senator gets even 10 phone calls in their office in a single day from House senators, they think that's blowing up the phone lines, right? And so they're going to respond to that. Similar with social media, right? They have staff members that are doing nothing but following their social media channels. And so all of a sudden, if they're starting to see that they're being tagged in these, they're going to start paying attention to it, right? It might take them 3 or 4 hours to get to their email, but they're looking at Twitter constantly, right? They're looking at their social media channels constantly. They're listening to the phone lines constantly. They have staffers specifically dedicated to doing nothing but that. And so I think it's a much more immediate way of kind of reaching people and getting your message across. And if you follow our social media channels at HC Advocacy or NACHC, we're often posting, probably more so on HC Advocacy, we post a lot of these same messages that you can then replicate and post on your own channel. So again, you don't have to do the work of figuring out what to say exactly, but you could retweet that message and then tag your own member of Congress, and they're going to start paying attention to that because that's something that they have their phones all day long, and that's something that they definitely pay attention to as well. I would also say, coming from, you know, the health center environment, I recognize that local initiatives and state initiatives are just as important, if sometimes not even more important, in what you're doing on a daily basis. And we totally recognize that on the national level. We actually had a state rep that was one of our board members for a long time. He lived in the area. He was a patient at our health center. And it was so interesting because he always said that whenever even if you're looking at a local council person, right, or whoever it might be that's coming to your health center and learning about you, you never know where they might end up later on in their political career. Oftentimes they have different aspirations, right? So somebody who might be a local congressperson today is suddenly sitting on your joint finance committee at the state level tomorrow, and then might be a US senator moving down the road, right? And they will remember you if they had a good interaction. So that relationship building that you're doing, even on the local level today, will likely pay dividends in the future. So never think that your advocacy doesn't matter. Never think that because maybe they don't see eye to eye with you on every bill, that it doesn't matter. On this last funding bill that we just had in the House on the federal level, we had more people on the Republican aisle vote for it than we ever thought we would. And people who have never voted for House Senate bills before in the past voted for this bill, right? So I just say that to say you never know what's going to happen in today's environment. So always have hope that what you're doing is making a difference.
I think that's a great reminder, and we actually have a great recent example. So Mike Flood was a state senator from Norfolk, and he is now a congressperson. So we, you know, that's just one recent example. Adrian Smith is another one who was a state senator and is our council person for District 3. So you just, yeah, you never know.
And they both voted for health center funding in the House right before winter break. So they've gone on to be good advocates at the federal level. So I'll maybe just throw one last plug in, and then Angela, I'll turn it back over to you. When we started our work with Catalyst and with Tim and Kaitlin and Liz and Taylor, one of the things we really talked about was making sure that we're educating along with doing the advocacy work. And so if for our health center members who are on, if you are interested in doing some level of education or information with your board of directors, know that that is an option that is out there. And I know Catalyst is happy to work with you. We're happy to help coordinate that. Certainly we have a lot that's going to be happening at the federal level too over the next 2 weeks, especially, but certainly throughout the year. And so just know that we're always open and willing to do that. And it can be as short or as long of a presentation as you would like, but really just working on educating and trying to tear down, I think, some of those myths that advocacy is a little scary or overwhelming. So Angela, with that, I'll turn it back over to you.
All right, thank you, Amy. And thank you to Sarah, thank you to Tim, and thank you to Kaitlin for presenting today. We really appreciate your time. This has been super helpful, very educational, and I'm really appreciative of your time. So with that, I will be sending the recording and all of the resources after today's call. Enjoy your day, and thank you so much for joining. Bye, everyone.
Thank you.
Thanks.
Thanks, everyone.